Good afternoon. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas. Today's Friday, August 13th, 2021. I didn't realize it till right now. It's Friday 13th, so that's weird. It's probably the way I'm feeling the way I am right now. But happy Friday 13th and August 13th. We'll start off just because I have to. Yesterday was my brother's birthday, Jerry Wayne, my older brother. Then on Sunday is my father's birthday. So I want to wish my dad and my brother both a birthday as for August as well. So I look forward to seeing him Sunday and wishing him a happy birthday. From a Titus perspective, we wanted to get on real quick and just talk. Had a great presentation last night, and we're going to talk about that today. But just want to give numbers real quick and a couple things that are going on. From a numbers perspective this morning, we are sitting with 20 patients in the hospital and holding patients in the emergency department. We've talked about COVID cap of 12 a couple days ago because of staffing. We've had to exceed that. We haven't had a choice. So we've increased to 20 COVID patients in the hospital right now, and we're holding in the emergency department several patients from both the med-surg and COVID floors. We're in the process of opening some expanded clinics in the hospital to help with that, but right now that's what we're looking at. So you can look at the Region F, you can see one available ICU bed in our region, and you can see that's gone from 15 and 14 down to 1. So 177 in the thing, so you can see it in there. From a testing perspective, we saw last week 152 positives in our region that we look at, about 27% positive. So that's been consistent over the last 2 weeks, about 150 positive. So we're continuing to see them, and I expect that number to be the same this week or higher. From a vaccine perspective, I'm still encouraging you to get vaccinated. And when you look at the vaccine, we're sitting at 42% for our region of first dose eligible. We've been vaccinated. Right now, we're sitting at 44% for Titus County and 42% for our region. I'm excited about that because over the last few days, we've seen some of our highest numbers in the vaccine clinic, not near what they need to be, but as we're going to increase, we're 44% above the region, and I appreciate it. We're still behind when it comes to the first dose, but you can see from the second dose we're behind, but the first dose you can see we're making progress. So I've got a question for you. How are you testing for Delta when we're still using the same COVID-19 test right now? The COVID test picks up that, and that we're using the same PCR test, and it's picking up that variant. So they know you have it in your system. So we're still being able to pick up whether it's Delta or either variant. It's still testing positive for COVID. Now, I cannot tell you which variant it is. So we're not testing for a specific variant, we're testing for COVID. So that has to be sent off to the state and special tests done to break down which variant. But our tests that we're using, both the rapid test, the PCR test, the test that we send out to FLET on a daily basis, which is the Texas Department of Health, or the test we send out to commercial labs every day. Right now, because of the lacking of testing and staff, we're sending tests on a daily basis to 4 or 5 different places to assist us to stay ahead of testing for this area. It's a great question, and I appreciate that. Last night, I just want to thank Dr. Stagg, Dr. DeLisi, and Dr. Hooks, and the over 300 people who joined us live, and then over the thousands and thousands and thousands of views that we've had in the last 24 hours of our COVID vaccine town hall that we did last night. It was great for us to sit there and spend time with them. They gave their time to this community. I'm truly appreciative. I learned last night, and I got a lot of texts. I learned the word learned last night, that I could use that in a sentence, and look, and I appreciated learning that last night. But these 3 gentlemen and Dr. Thurman, who was on text and online last night, did a great job of just communicating their knowledge. Our goal last night was to be transparent. Another question I have, how many percentage of COVID tests are being sent out to be tested for the Delta? And again, we're not specifically sending out to test for the Delta. The state's handling that, and the state took that over a few weeks ago. The state takes their information and is doing that. In the beginning, about 3 or 4 months ago, we sent out a couple tests to make sure that we were seeing Delta in the area, and we did. So from our perspective, we're not treating the Delta variant versus any other variant. From a treatment, Dr. Thurman and the medical staff have the same treatments work regardless of the variant that they have. So for Titus perspective and around here, you got COVID, we're treating you with the methods. But again, want to thank the doctors for the work they did last night, and we've gotten a ton of great comments and some more questions that we're continuing to follow up on. One of the things I wanted to encourage is continue to vaccinate. We are going to need to move our vaccine clinic. And I know that's going to frustrate some people from a walk-up perspective. We're calling everybody today. But due to the increase of COVID at the hospital, due to the number of patients we're holding in the emergency department for 4, 5, 6 days, we're going to have to move that clinic so we can open up that area into a clinic, a respiratory clinic, kind of an expansion of the rural health clinic. Family Care Center Harts Bluff is going to be extended into our old admitting area right there. In order to do that and to keep everybody safe, we are going to move the vaccine clinic to Medical Plaza next to the Wellness Center. It's the first floor. You can park right there on the north side of that building, walk right in. My wife's going to be there to greet you after you get screened, and they'll get you a test, they'll get you ready, and your vaccine right there in the lobby. Quick, easy way to, it'll be quick and easy out. So we apologize for moving it. We don't want to, but given the increase that we have in the hospital, we don't have any choice but to move that and expand our operations in the hospital. We're also excited to announce, and I want to thank one of our employers in town. I want to thank Pilgrim's Pride. Pilgrim's Pride has worked with us for the last few weeks to improve our vaccination rates. We've worked with Pilgrim for the last 17 months now, the beginning of COVID, and we worked with them on their plant. Their team, both corporate in Colorado and more important locally, working with Roger and the team in the human resources and their COVID team, have done everything they possibly can to minimize COVID in their plant. Their vaccine rate is higher than Northeast Texas, for sure. Their vaccine rate is higher than the state of Texas of what they're doing. And we work closely with them. They are partnering with us and the city of Mount Pleasant tomorrow to do a vaccine clinic in the Civic Center. We'll be at 8 o'clock to 2 o'clock at the Civic Center here in Mount Pleasant. Pilgrims is doing an opportunity to win free meat for a year. So there'll be a drawing of all the different places, and this is going to be included in that. So you can go online and look at the details and see that exactly. But we thought this was an opportunity to partner with them, an opportunity for Titus to provide that vaccine to the community. So tomorrow, anytime between 8 o'clock and 2 o'clock, it's walk-ins. Just come to the Civic Center, get your vaccine. We will have a few Pfizer vaccines there. If some children show up who are under the age of 18, 12 to 17, we'll have that for them. We'll not have a ton of it just because it's hard to store, but we will have some of that there. But we will have the Moderna vaccine tomorrow. So please, 8 to 2 tomorrow. If you're not vaccinated, please stop by. First dose or second dose. I think you'll be first dose to win the meat prize, but we just want to get that vaccine in your body and help you out. But again, thanks to Roger and the team at Pilgrims and everybody for their support of this and working with us to mitigate the spread. I want to finish today and just ask you to keep wearing your mask. You know, everything that we've seen, washing our hands, social distancing, it all works. And we're right now, everybody's tired. The health system's tired. Our team members are exhausted. They've seen death for the last few weeks again. And, you know, it's harder this time because it's younger people and it's people they know. So I would just asking you to keep in your prayers. We led off last night our COVID town hall with a prayer, just individually in this room. And it meant so much to me to listen to our physicians pray that we started our town hall last night with a prayer. And I truly appreciate all three of the doctors who joined us last night. And they consistently asking you to pray for our team. They need it. They need the support, and they need the support from only one person right now, and that's the good Lord above. Truly appreciate everything you're doing for us in this community. We truly appreciate the support that you give us. I ask for your patience when you come to the health system. I appreciate if you would get vaccinated. We'd wear your mask, wash your hands, and social distance. On behalf of the staff at Titus, I just want to thank you for your support. God bless.